can you correct grade 3 inverted nipples without cutting the milk ducts? It was, I think that was it. If the person who put that question wants to clarify that and say it wasn't that, then come back at me. But I think that's what they were saying. So basically, yeah. So first of all, different types of nipple inversion. So essentially, it depends on whether it comes out sometimes or if it comes out never. Whether you can coax it out or not. And the more likely you are to coax it out. So if the nipple's sometimes out and sometimes not out, then you could look at things like suction cups, the nipplet device, and what have you. So that was something that the more deeply inverted it is, and if it's deeply inverted all the time, then you would worry that suction cup's not really going to stretch those ducts enough. Now, the reason that you've got an inverted nipple is because the ducts are shortened, the milk ducts are shortened. And there's two ways to correct an inverted nipple. The best way to correct an inverted nipple is by cutting those ducts. Now, there is, whichever way you do it, there's a risk of it coming back. So there's a risk of it coming back if you use a suction cup. There's a risk of it coming back if you do surgery. Now, if you cut the ducts, you're reducing your risk of the inversion happening again. Now, having said that, when you cut the ducts, there is a space which can fill up with scar tissue and put it back down again. So there is still a risk it can come back again, but it's less of a risk, and we try and bolster it up and put some sutures into it, but it doesn't come back down again. But of course, if you're cutting the ducts, then you're not going to be able to breastfeed in the future. So that a lot of people think, oh, I'm not sure about that. Like this person here saying, can you do it without cutting the ducts? Well, yes, you can do it without cutting ducts. You can do it by keeping the ducts intact. And you just tease them up in a line in the line of the duct. So you're not cutting the ducts. This way you're going in the line of the ducts, tease it up, tease the nipple up, and then you have to hold it up somehow. So you can take a flap of skin from the areola, put it on either sides, and try and hold up the nipple that way to sort of bolster it up. The bad thing about that is, number one, there's scarring on the areola, whereas when you cut the ducts, you don't really have any scarring on the areola. You have a tiny little incision at the base of the areola you can't really see, whereas this has got sort of radial scarring going out, which you might be able to see. It usually blends in pretty well. But the main risk of that is because you're not really cutting the ducts and you're just trying to pull them and stick some tissue in to stop them from dropping down. There's a higher risk of recurrence or incomplete correction. And so if they're deeply inverted, eye moving, and again, this comes back to what I was saying at the beginning, everyone's got their own views on things. I'm moving away from doing that, to be honest with you. I'm like, I don't, it doesn't look as good when you don't cut the ducts. It's got a dent in the middle, it can pull back in. As I say, yeah, that can happen when you do cut the ducts. So it's even more of a risk when you don't cut the ducts. So I would be questioning whether it's worth doing surgery if you're absolutely sure you don't want your ducts cut. So if you don't want your ducts cut, and you're saying, I want to breastfeed now, you might not be able to breastfeed anyway, given that you've got a significantly inverted nipple. But if you absolutely sure you want to try, I would say just don't have surgery and see how you go. And then once you've finished your family, what have you, maybe think about having it done, because I think the most long-lasting way is definitely to cut the ducts, and the most sort of I'm not sure if impressive is the right word, but the most complete correction is with cutting the ducts, in my experience.